She thought it was just back pain, maybe stress, or maybe her period. But a few days later, she collapsed and it became a life-threatening emergency. By the time the doctors figured it out, her fallopian tube had already ruptured. It wasn't just back pain, it wasn't her period. It was an ectopic pregnancy, which nearly took her life. Now, the scariest part is that ectopic pregnancies don't always come with loud warnings. Sometimes it's just mild cramping or spotting that may seem harmless. That is why so many women, especially in the early weeks, miss these signs. And when they finally realize something is wrong, it is already an emergency. As a nurse, I've seen firsthand how fast this can escalate. That is why I'm here to make it simple for you. So let's talk about the symptoms of ectopic pregnancy you should never ignore. And please, before we continue, take a moment to like this video and subscribe to my channel so a lot of women out there will get to see the video and learn from it. First, what is ectopic pregnancy? Ectopic pregnancy happens when a fertilized egg implants itself somewhere outside the uterus, that's the womb, usually inside a fallopian tube. But here is the problem. It can't grow there safely. As it tries to develop, it can cause the tubes to burst, leading to dangerous internal bleeding. That is why it is important for you to catch these signs early. So here are 5 symptoms you should pay close attention to. The first one is unusual pelvic or lower abdominal pain. This is especially concerning if the pain is sharp or concentrated on one side. Sometimes it can start off as dull pain but slowly get worse. A lot of women mistake this for gas or period cramp. This is one symptom you should pay close attention to. The second one is vaginal bleeding or spotting. It's not going to look like your usual period. It might come earlier, look darker or lighter than normal. Some women confuse this for implantation bleeding, but it can be a red flag. Check out my video where I talked about the difference between implantation bleeding and period bleeding. So you'll be able to tell when it's period or when it's implantation bleeding, so you don't confuse yourself further. The third tip to look out for is shoulder tip pain. This one is surprising to a lot of people, but the thing is, internal bleeding can irritate the diaphragm, which can lead to pain in the shoulder, especially when you're lying down. It's subtle but can be very serious. So this is one symptom you should pay close attention to. The fourth one is sudden dizziness or fainting. If your ectopic pregnancy has caused internal bleeding, you may feel lightheaded or even collapse. And this happens when blood pressure drops dangerously low. Please do not ignore this sign. The fifth one is painful urination or bowel movement. This is because ectopic pregnancy can put pressure on nearby organs. You might feel pain while peeing or pooing. That is why many women confuse the sign for a UTI or indigestion. So this is one sign you should pay close attention to. Now here is the hard part. These signs often feel normal at first, but if something doesn't sit right, don't wait. Your body is wise. It knows when something is off. Let me say this clearly. Not all pain means danger, but ignoring it won't make it any better. So it's better to get it checked because early detection can save your fertility and your life. If you are sexually active and you are experiencing all these symptoms, get a pregnancy test done and see your doctor as soon as possible. You are not being dramatic, you're just being careful, and being careful is powerful. So guys, if this video gave you clarity, please take a second now and like this video, subscribe if you haven't, and tap on the bell icon so you don't miss our videos. Always remember, your health is your wealth. Little changes makes a big difference. Thank you for watching and see you in my next video. Bye.